here to update on our latest efforts regarding COVID-19. We are going to be engaging in a public-private partnership with the Memorial Healthcare System in Broward and the Florida National Guard to set up a drive-through testing operation. We already have 170 plus guardsmen in Broward County. We'll have several hundred more by tomorrow. And the idea is, because we've had more cases in Broward than anywhere else, we want to be able to supplement the healthcare system there. So we really thank Memorial for wanting to partner. We think we're going to have a way to do this successfully. I will say, though, that this has been tried in some other states, and I know Colorado tried it. They had to shut it down. There have been problems in some of the other ways. So we want to do it in a way that's going to make an impact. As Dr. Fauci just said in the press briefing, this is going to be a convenient way for a limited subset of the population to be tested. We're going to have that, that firm guidance come out when these things open up. But clearly, the folks who are elderly, that have symptoms, that have an underlying medical condition, we want to have the easiest way possible for them to test, and then, if need be, to get treatment or to self-isolate. And I think that this will be something that will be beneficial. I've been on the phone with the CEO of Memorial, Aurelio Fernandez, their Chief Medical Officer, Stanley Marks, Broward County Administrator, Bertha Hendry. So we're going to work really hard to get this up and running as soon as possible. But I think Memorial has a high capacity to accomplish the mission, and obviously we want to put resources where there's the greatest need. And so being able to identify and get a baseline of how much this is spread in Broward is going to be important, and it'll help our efforts at containment and mitigation. And of course, all of these COVID-19 tests will be free to the patient. I'm also going to have Halsey Bashirs, our DBPR Secretary, and DOH work together, and we'll get the CDC guidelines on this. I think it's going to come out tomorrow. But we have this issue with these bars and these spring breaks, also how to handle the restaurants. I think that you have a lot of folks taking a lot of important measures around the state. You've seen it with major events canceled. You've seen different things with the schools. You've seen nursing homes and assisted living facilities go to great length to protect the elderly population. But then you see these images over the weekend of these massive gatherings of a lot of students, college students, in places like Miami Beach. And so, that is something that's problematic, because although COVID-19, the data suggests, is probably not a very serious threat to the health of people who are young and don't have underlying medical conditions, they can still acquire it and transmit it to others. And those gatherings are prime ways to be able to do that. So I spoke today with the mayors from Fort Lauderdale and Miami Beach, and I think what they're doing by imposing the curfews, what they're doing for the beach access to try to basically effectively pull the plug on these big spring break gatherings, I think is the right way to go. We're going to have probably specific guidance, but we want to wait to discuss with the CDC. We had asked for the guidance. They are going to put it out tomorrow. But at the end of the day, we have asked to not have gatherings over 250 people. And as I said, you've had some really serious events that a lot of people are looking forward to that have been canceled because people are trying to do the right thing. So to have people congregating in these bars or on these beaches like this, I think undercuts the efforts to protect our vulnerable populations. In terms of restaurants, we want to work with the CDC. I think that people have said just close all restaurants. I don't know that I'm convinced that would be necessary, but I do think areas in the country, you've seen municipalities say, there needs to be a certain amount of distance between each table, maybe have a 50% limit in terms of the restaurant. I think that would probably be something that would be more feasible, and that would also make a difference by having people spaced out enough. But we're going to work through that and put out our guidance on that after the CDC weighs in. But the reason why things like this are important with these gatherings is you have a situation where you're going to continue to see cases multiply. I think what's happened in Florida is pretty much similar to what's happening in other parts of the country and in what you're seeing in Europe. I think they're a couple weeks ahead. And so the question is, as you see more people acquire the virus, as you see more people that are going to be needed to be hospitalized, what kind of stress does that put on the healthcare system? And we have some capacity to absorb an increase, but we don't have a limitless capacity to absorb an increase. And I think it's important that these social distancing measures are implemented so that we're able to prevent infections from running completely out of hand. So that will be, I think, a goal when we're dealing with it. But I think you have local communities that I think have done some good things, and so I want to applaud those that have done it. I think it's really, really important. There was a Holland American cruise ship, New Statendam, arrived in Port Everglades early this morning. So there was a deceased passenger. There was the passenger had chronic underlying conditions. There was a concern that person may be positive for COVID-19. The person came back negative. Once the state got involved, we said, wait a minute, we need to make sure that there's not going to be a problem here. Then once the negative result came back, then the rest of the folks were allowed to disembark, and that was done simply because we need to protect the safety of those folks in our communities. And there were no other problems on the ship other than that, but that was obviously a concern. I've also asked the Department of Health to provide as much amplifying data as possible on some of these positive COVID-19 cases, particularly unlinked cases. And so you'll say someone from Broward, but what about which city in Broward? And so they're working on that, but I think having some more amplifying information would be helpful to folks. I've also sent a letter to the Federal Small Business Administration to turn on the SBA loan program for small businesses. As you see how this has affected the economy, a lot of attention is paid on kind of the big cruise liners, the big airlines, and those are obviously important industries. We're going to have a lot of small businesses that are impacted, and these are people that are working hard, didn't make any bad business decisions, and are basically being, they're suffering negative consequences because of a totally external event. So I think we want to make sure that we're there for our small business folks. We have been in contact with folks, up and down the local level, business community, folks at the federal level. I was able to speak with the CEO of Publix today. A lot of people are going into Publix and buying a lot of stuff because they're going to spend some time at home. We anticipate that there's going to continue to be availability of food and the like, but at the same time, some of the demand is very high, and that's just kind of the way some of these things work. But they're working really hard. They changed their hours so they can work on cleaning the store, restocking the shelves. So I want to thank them for what they've done. We have been able to talk to some of the mayors, as I mentioned. I spoke with the 7th District Admiral for the Coast Guard, Eric Jones, about some of the issues. There was an issue about sending a cruise ship that wasn't supposed to be bound for Florida here, and we asked that did not happen, and it's not going to happen, so I want to thank them. Spoke to both the Spirit and JetBlue CEOs about how the airlines are weathering this storm. It's been very difficult for them. I've also spoken to Tampa General CEO John Porras and Nova Southeastern University President George Hanbury. They had a lot of students who were infected in Ireland, but Nova did a good job of getting them isolated, and that's what's going to happen for the next 14 days, which is great. I'm also directing DMS Secretary Satter to allow state employees to donate and transfer their available leave time to other state employees to mitigate the impacts of school closures. And basically, we're thinking about two parents who may both be state employees. When you have schools closed, this allows one to be able to be there with the kids, and they're able to use their other spouse's leave time if they need to. So I think that makes sense, and I'm glad to be able to do that. So we are continuing to work really hard protecting the elderly. We're going to continue to stress that. We also are continuing to work to acquire the necessary supplies. We've got a lot. Jared has already distributed the 1,000 test kits. So you have 500 that have been distributed to hospitals, private labs of the like around the state, and then 500 have been distributed to various county health departments around the state. So I want to thank him for working really hard on that and getting it done. So this is a situation that is continuing to evolve very rapidly. You see, as more cases come in, you see larger and larger numbers. We anticipate that that will continue for the foreseeable future. And the hope is that the efforts that are done, that have been done over the last several days, will continue to be done, will have an effect. But that effect will probably be seen further down the line. But if we do see progress there, then I think that will really alleviate some burdens on the healthcare system. So I want to thank all the folks who've been working really round the clock, not only here at the EOC, but a lot of our municipal officials and county officials, and then of course the folks and the task force in Washington. I mean, you watch the press conference, you can tell they're working hard and they're working round the clock. We're going to hear from a couple folks here, and then we're happy to take some questions. So Jared, you want to?
Governor, thank you. At the governor's direction, DEM is at a level 1, and we've gone into action immediately. Over the last few days, we are continuing to up our orders, to plus up everything that we believe our first responders, our healthcare workers, and our folks are going to need. Protective PPE right now seems to be the thing that everyone is requesting. We are moving N95 masks around the state as those requests come in. We are also focusing on hospital surge. As the governor talked, our capacity right now is fine, but we are making preparations around potential surge by having nurses on standby, mobile hospitals, the wraparound services that those will be needed, as well as the ventilators that the governor instructed me to order. I want to thank the National Guard, partnering with them. They have begun to mobilize into Broward County. As many of you know, there are still communities that are waiting on the reimbursement money. So I made a decision that for hospitals and local communities, that if they were close to getting that money out the door, we released it. So we moved $40 million this week to cities and counties and hospitals so that they could get their reimbursement money still from Hurricane Irma. Social distancing. Social distancing is extremely important. I can't emphasize that enough. It is a smart practice, and I know it's inconvenient. It's also, I know, inconvenient not to be able to go visit a loved one at a nursing home. And I want to thank the Secretary of Agha, who's done a very good job in very difficult circumstances. I know you want to go see your loved one, your grandparent, or your parent, but at the end of the day, you could save their life potentially by not going to see them. If there are large events that don't get canceled, that doesn't mean you have to go. Please stay away from large events that may not get canceled. Additionally, stores are putting in limitations of supplies. Please adhere to those limitations of supplies in the stores, but we are not seeing any supply chain issues. The stores are constantly restocking. Here in Florida, we're used to hurricanes. You do not need to do the usual things that we prepare for in hurricanes. You do not need to fill up your bathtub with water. You do not need to go out and buy tons of bottled water or canned goods. There is no anticipation of power going out, or water or boil water issues, or problems with the internet or telecommunications. So you can buy regular goods for your refrigerator and your freezer like you would on a normal day. Do make sure that you have medications and potentially a first aid kit. Again, I want to emphasize that by social distancing, you may keep yourself from getting sick, but truthfully, you can be a hero to the person next to you, because while you may not get seriously ill, you never know what the underlying medical conditions may have for that person next to you or the elderly next to you. So Governor, thank you. I want to thank all the agency heads who have worked in a coordinated effort.
Surgeon General.
Thank you, Governor. I want to continue to emphasize that individuals know what COVID-19 is. This is a respiratory virus that hits the lung. 70% of the time, people with COVID-19 are going to have a fever and a dry cough. About 30% of the time, individuals are going to feel tired and produce sputum. And about 15% of the time, people may have shortness of breath, headaches, and a sore throat. And in a small percentage, some individuals may have a runny nose or diarrhea. The risk as far as getting COVID-19 is being exposed to somebody who has this virus, individuals who've had international travel, or individuals who've returned from areas where we're seeing outbreaks in the United States. To this point, the federal government announced travel restrictions on individuals returning from Europe. But if you have returned from an international destination where there's COVID-19, if you've returned from a cruise, or if you returned from one of these outbreak areas in the United States over the past 2 weeks, please practice social distancing, avoid being around the elderly, avoid being in large crowds, and most of all, if you find yourself becoming ill, self-isolate at that point and seek medical attention if needed. In terms of our public health strategies, 2 goals: to contain and isolate individuals who have this, so if we identify individuals with COVID-19, they won't spread it to others. Then also the mitigation strategies, which we've heard about, which involves avoiding mass gatherings. The health community, important things to consider. First, as was mentioned earlier, please protect yourselves and your healthcare workers. We need you to be able to serve the public. Make sure you're using personal protective equipment. Develop sites where you can be seeing patients with COVID that may be separate from your main facilities. And also prepare for new models of healthcare that may involve telemedicine and other ways to connect with the public. As was mentioned earlier, the public health measures, we will continue to emphasize these. The best way to protect yourself is avoid being around sick individuals. If you are sick, don't go to work. Cover your cough, wash your hands, and most of all, the best way to avoid getting COVID-19 is to avoid crowds. Thank you.
Thank you, Governor. Thank you, Surgeon General and Director Moskowitz. This is unprecedented. And for our state and for the percentage of our residents who are elderly, we have an even greater challenge. We understand that this is creating fear and panic. And we need everyone to stay focused on our shared priority of protecting our elderly and our medically frail from this infection. This situation is rapidly evolving, and we are getting new information and more refined and specific guidance daily. The mission of my agency and the work we do here is critical to support the healthcare facilities and staff on the front lines of this emergency. And like the governor, I want to express our appreciation for the dedication that they are demonstrating every single day. To protect our elderly, we are implementing comprehensive restrictions on visitation with few exceptions. Nursing homes, assisted living facilities, and other long-term care residential providers are discontinuing their visitation for at least 30 days with few exceptions. And we're doing this to protect our most vulnerable. Again, this is done because of our love, concern, and compassion. Our long-term care providers are communicating with family members to support alternative ways for them to connect with their loved ones. We cannot wait until COVID-19 is spreading through a nursing home to act aggressively on prevention. We have to take decisive action now. We need hospitals to be strong and effective partners with nursing homes and assisted living facilities and other residential providers to act urgently when a frail, elderly individual fits the indicators for COVID-19. We cannot have false expectations about the ability of our long-term care providers to effectively isolate their residents and contain the spread of the virus if they do not have negative pressure rooms for isolation and N95 masks. Additionally, timely testing for our elderly and medically frail is mission critical. Over the last 6 days, my staff have visited over 300 nursing homes and assisted living facilities to support their comprehensive adherence to infection prevention and control. My staff are also immediately responding in partnership with county public health departments to long-term care facilities where there are suspected or known COVID-19 cases. Our job is to support these facilities and to ensure that the infection can be contained with appropriate isolation. As hospitals see demand increase, it is imperative that they use their emergency preparedness plans to postpone elective procedures in order to support prioritization of their healthcare workforce. We also know that hospitals are taking the necessary steps to also restrict visitation. Furthermore, at the direction of the governor, we are working with hospitals and health systems to identify additional hospital buildings that may be partially or completely vacant that can be used if demand exceeds our current hospital capacity. Additionally, we are evaluating the same for our long-term care buildings throughout the state. Finally, I am working closely with Director Moskowitz to coordinate the deployment of critical personal protective equipment, including N95 masks, tie-back gowns, and other needed supplies for hospitals, long-term care providers, and other healthcare facilities experiencing shortages. We will continue to work in concert with healthcare facilities, local departments of health, and local EOCs to ensure needs are being met across the state. We are all in this together. I appreciate every person taking precautions to help prevent the spread and protect Florida's most vulnerable populations. Thank you.
As Florida's Chief Elections Officer, I take my duty and responsibility to Florida voters very seriously. I want to ensure Florida voters that we have been working with the Department of Health and with the local supervisors of elections to ensure the safety and the well-being of all who are involved in Florida's elections. We have multiple voting options under Florida law. As of this morning's report, over 600,000 Florida voters had participated in early voting, and over 1.3 million voters had taken advantage of our vote by mail option. Today was the last day for early voting in Florida. However, voters can still request a vote by mail ballot and pick it up or have it picked up for them at the Supervisor of Elections office. We are following all guidance from the Florida Department of Health and from the CDC. That guidance tells us that Floridians can safely and securely go to the polls to cast their ballots in Tuesday's presidential preference primary. Precinct-based voting, where voters within a community cast a ballot, is nothing like the large gatherings our health professionals are encouraging Floridians to avoid. Voting is quick, it is community-based, and voters and election workers can follow all health and safety precautions that have been shared with us by our healthcare experts. If a voter has been ordered to self-isolate or is experiencing symptoms and has not yet voted, they should not go to the polls and instead should designate someone to pick up their vote by mail ballot for them. Information on these procedures and how to exercise them is available at the Department of State website and also with all of Florida's 67 supervisors of election. Whichever voting option is used, Florida voters need to ensure that their ballots are received by the Supervisor of Elections office by 7 p.m. on Election Day. We have provided to all of the supervisors of election guidance from the Florida Department of Health and the CDC, best practices for hand washing, sanitation, and recommendations for elections polling places, as well as guidance from voting machine manufacturers on how to best sanitize voting machines. As with any election, before a voter goes to the polls on Tuesday, they should check their local supervisor of elections website for the most current and up-to-date information about polling places. Contact information for all supervisors can be found on the Division of Elections website. Thank you.
Happy to take some questions.
Governor, you talked about mobile hospitals earlier. Are they already in operation? If so, how many?
Well, so Jared had talked about what we have in the state. There are hospitals that are doing things on their own, but he can speak about what he's got for our DEM.
Yeah, no, so we've secured a 250-person mobile hospital, as well as a 100-person mobile hospital, as well as ventilators and all the wraparound services that you would need to set those up. They are not set up yet because until we know exactly which hospital might need the med surge, we don't want to set it up and then have to take it down and move it.
Then we're also in different parts of the state. So when we were at Jackson and down in Miami, they have buildings that are no longer used to be hospital medical. There's other parts of the state where you have it, or there's some hospitals that don't use several wings. So Mary Mayhew's looking at that so that if you do need to kind of divert the COVID-19 patients to one location, that there would be able to be licensed and be able to done very quickly. I've spoken with some of the hospital executives, and they think that could be a good idea depending on how the circumstances unfold. So it's something that she's already working on, and then if it comes to that where there's that need, I mean, I think the fear is less that they'll run out of hospital beds, although eventually, I mean, that could happen, just depends. But the biggest fear is the healthcare workforce gets put on the sidelines because you have exposure to a COVID-19 patient, and then you have to have 20 people in your hospital self-isolating. That's going to be very difficult. And so that's one of the reasons why having this mobile testing site, so those folks can go through there rather than show up, at a hospital. That's why some of the other hospitals are working, and they have plans to be able to have some temporary facilities outside their main facility to be able to accommodate that. But it's an issue of capacity, but really is an issue of protecting the workforce, which is very important. Yes, ma'am.
Governor, can you expand a little bit about the mobile testing site? When will that open up, and is the Memorial partnership the only partnership that's going to be working on this?
It might not be the only one. I think we also, I've spoken to, some other folks throughout the state. I spoke with the Broward Health CEO as well. And I think that General Eifert's got enough resources there that we certainly probably could assist others. And so their orders are to get this thing up and running as soon as they can. But I don't want to say it's going to open at a certain date at a certain time because there's a lot to go in this. We want it so that when it opens, it's done right, and folks will have a place to go. But that is their top mission right now for the state, and they're going to work hard to do it. And obviously, as this evolves in other parts of the state, may need to augment other places. We are requesting from the federal government that some of the sites they're talking about, that they put at least one or two in Florida to augment what we're doing. I think if you look, I mean, obviously New York has many more cases in California and all this, but we have a big state. There's a huge volume of international travel that comes and goes from here. So I think we would be a place where they would be able to augment us, and I think that would be effective. So we we're mindful that you got to be nimble in this thing. But right now, I think Broward, and then to a lesser extent Dade, I mean, those are kind of the places where we're seeing the cases really pop up.
Governor, Broward and Dade both also have two of the biggest airports in the state. I mean, is there still talk about maybe asking the White House or DOT to shut down or restrict flights coming in from states where?
So I think that the issue with the flights is, I think what they've done with international travel has been very helpful. If you look at what this happened with China, when we were first dealing with this in January, I mean, our fear was you just have people coming in who weren't showing symptoms and then ended up getting sick. So what they did with China really helped. I think Europe is now the epicenter according to the World Health Organization, so that helped. I'm glad they added Ireland and Great Britain because we just had a bunch of people come in from Ireland. And then I also think the way Great Britain has handled it, I think they're operating under a little bit different theory than our government and most of the other governments. I think they are maybe trying to welcome a herd immunity amongst their younger folks, that is a risky strategy. So I think having them restricted is good as well. And then in terms of domestic flights, I think it's not just, I don't think they're going to restrict just all travel, and I'm not asking for that. But if you have certain hot spots, and there's only a few of them, I think Washington State has California, Northern California, New York City. Those are some. So I think that they should think about that. Obviously, there's implications for that. But I do think that the more travel you have to and from these hot spots, the more it's going to spread to other parts of the country. I mean, that's just the reality.
Quick side question.
You've asked schools to stay, sorry, is that a follow-up?
No, you go, sorry.
Go ahead.
You've asked schools to stay closed for the next 2 weeks, and are teachers going to be expected to work from home during that time or go to school?
So, well, I think the districts will determine that. I think what Commissioner Corcoran has done is he has been building a capacity for online learning. So as the spring break period ends, the students will be at home, but you would have some capacity to do that. Now, I know there's going to be problems. Not everyone may have access to be able to access that, but they're trying to provide that as a way to deal with this. But look, at the end of the day, none of these solutions are going to be perfect. So we'll see. But I do think being able to have a pause, see where we're at in a couple weeks, then you can kind of go forward and make a decision at that time.
Any thought why we're not seeing any of these cases propping up in the Panhandle area? I mean, we're seeing them in Baker County and Clay County. They're kind of adjacent to Jacksonville.
Well,
but
I
here
mean,
we
I
are in
think-
this Panhandle Beacon area, and we're not seeing these cases because they're not testing this area.
Well, so in fact, when we were putting the testing kits, I know I was talking to Congressman Gates. Their hospitals, did have some, but we augmented that, so they've had the capacity to do it. I think it's more of just, if you look at parts of the country where you've seen a lot of activity, it typically is areas where there's a lot of travel internationally. And the West Coast, obviously, the close connection with China and the number of people that go back and forth. New York City, everyone obviously goes to New York City. Now in Fort Lauderdale, you have the cruise liners, which we've already linked a number of cases to that. So I think it's more about that. But anyone who's shown up at our Department of Health in those areas, that has had symptoms, has been able to be tested. So but I've said all along, because you have some people that are so mildly symptomatic with this, the idea that just the people that are testing positive are the only ones out there, of course we know that there are more. But I don't think it's anything to where like the Panhandle has been excluded. I think it's more just you probably don't have as many people who are traveling internationally as you do in some other parts of our state and of course of the country.
I have a question about the state's kind of older population. Obviously, Florida has an outsized population of folks 65 and older. The California governor called for in-home isolation of folks that are 65 and older. Is that something that's under consideration, and how are we going to?
Well, what we've said really for a while now is, if you're in those vulnerable populations, if you're elderly, if you're frail, or if you have a significant underlying medical condition, avoid crowds, protect yourself, don't go out, unless you need to. And we're not saying no one can go out and pick up medications at a drive-thru or something like that, but be very, very conscious of being involved in situations where there are large numbers of people, because those are the situations where you're most likely to encounter somebody who may be infected. And then obviously Mary has worked hard to protect kind of the senior population from the outside world going into assisted living facilities and going into nursing homes. But I definitely believe, if you're not feeling well as a senior, definitely stay home. Call the doctor, figure out what you need to do. And now is not the time, if you're someone with an underlying condition or senior citizen, now's not the time to be going on cruises. Now's not the time probably to be doing a lot of plane travel. So this is a time where you probably want to take the foot off the gas a little bit. I'm not saying you can't go walk your dog or anything like that, but in terms of some of those situations where you'd be more vulnerable to infection, I would certainly recommend not putting yourself in those situations.
Scott. What would you say to people who have spring break trips planned for here in Florida? I mean, should they be canceling their reservations?
Well, what I think that they need to understand is what you saw with the mayors of Miami Beach and Fort Lauderdale, and I think you're going to see more do this, is Florida's not going to be a place where you're going to be out till 2 in the morning with 500 people at some bar. At least that's what we're recommending. And I think that because what Miami Beach and Fort Lauderdale did, I think you'll see more municipalities do that. Those gatherings, I think, present high risks, and they're in some ways even riskier because these are people who will be carrying the illness who a lot of people wouldn't necessarily view as ill because the symptoms may be so mild. So you're somebody that you may not be having a 103 fever, you may not be coughing every second, but you still can transmit it to somebody. Well, that's a situation where, you know, that really can be problematic. And so the spring break stuff, like I said, I've applauded what those mayors did. I think that's the right thing. I mean, I look around, not just in Florida to see what's going on, but some of these other areas. You know, the college kids, some of them are on spring break, some of the classes got suspended, or some school years even got canceled at different universities. And the idea is, you know, we didn't want people congregating. That'd be kind of a petri dish situation where then people would go off and spread it. Well, you're just as likely to do that going out to bars as you are in a lecture hall. And I understand kids want stuff to do. Heck, when I was 18 or 19, I probably would have said this ain't gonna affect me and do it. So I understand the mindset, but I think it's incumbent upon us to be working together, local, state, and hopefully with the CDC's guidance tomorrow to kind of circumscribe the ability to have some of these really, really large gatherings. Look, missing out on staying out and drinking at a bar, that is not the end of the world. You're gonna have time to do that in the rest of your life. What you don't want is to be somebody who is helping to spread this illness, particularly if the virus ends up infecting people that are frail and that may not have immune systems that are capable of dealing with it. Those are the folks we got to be thinking about right now. And so all this spring break is as exciting as it can be for a college kid. You know, that just is not as important as protecting the public here.
Governor,
On
can
that
you
point,
detail,
Governor-
can you detail
One
any
last
of that?
question.
Thank you.
Go ahead.
Can you detail any of that? What sort of guidelines the CDC would be releasing in terms of this?
Not yet. So we worked really hard today to figure out, okay, you know, you see the images of these bars, you see the, you know, some of the issues with a really crowded restaurant. You know, what do we think makes the most sense? And so we've kicked around some stuff and had a pretty good idea what we were looking to do. But the fact that the CDC is going to address it, we feel it makes sense to listen to their guidance. We had been proactively reaching out to them to get their input on what would make the most sense. So since that's coming out tomorrow, we'll take a look at that, and then we will be making our recommendations to folks throughout Florida. I mean, I think, you know, because our state is diverse and we have different areas that are experiencing this different ways, I mean, I think it's best to kind of promulgate some general recommendations, but then obviously local communities, they can tailor it to their specific situations within reason, and I think that that's good. But I think to just do nothing and act like that, you know, let the good times roll, that would not be probably in the best interest of a lot of folks in the state of Florida. So we want to make sure we're protecting folks. But we'll have more to say tomorrow as we get the final details about the implementation of our mobile site. We'll let you know. And then we're also working on a couple other things that I hope to be able to announce soon. Thanks.